the leadership that is required to be able to make a difference in this sector. And I think, especially for patients, we always have to remember that at the end of any decisions we make, whether you're a clinician, whether you're a healthcare financer, whether you're somebody who is making other policy decisions like those of us who are sitting on boards of institutions that make a difference, we always have to remember that at the end of that decision, there's a patient, there's a life, there's a family whom we impact. And if we always have that in mind, I think it'll be a moral compass in terms of helping us make the right decisions. So that is one thing we also always need to bear in mind. And those who are patient advocates, this is the only time when noise is a good thing. Any time when we're advocating for patient care, for me that is going to be a joyful noise. So we must continue to advocate for our patients. And there are a lot of things that policymakers might not, some unintended consequences of decisions that people might not realize. And even in our system, as things become more efficient, for example, when you start providing treatment and it's being financed, one of the things I'm very passionate about is let us not make the cure for the disease more painful than the endurance of the same. There are times when we must admit patients are put on treatments that are inappropriate. So there are times when you've got patients who have reached the end of their life, and there is a time when we have to admit that the end of life has come, as opposed to making people incur expenses. There was a study that was done many years ago, and it showed actually that it's not, people assume that with advancing age you have got increased expenditure in terms of healthcare expenses. But that study showed that it's actually dying that is expensive. All right? And dying is expensive because a lot of our patients, especially in this country, they spend 90% of their entire lifetime health expenditure in the last few weeks of their lives. There has to be something there that we need to speak to, because it might very well mean that we're deploying resources where we're not getting value. And worse still, there are times we're deploying resources and diminishing the quality of people's lives at the end of their lives when the focus needs to shift to other things as opposed to clinical treatment. So with those few remarks, I'd like to welcome the Cabinet Secretary to share with us our words of wisdom for today. Thank you very much.